Hello everyone, I'm Kibin Alleyne and today is Tuesday, April 9th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. The Center for an Urban Future published a report titled 50 Ideas for a Stronger Bronx, which highlighted health as a major concern in the borough. Senior Director of Community Leadership Development at Grand Windham, Dr. Emily Lopez, and Board of Directors President for Bronx Community Health Network, Sandra Piggee, joins me to discuss their ideas on prioritizing health in the Bronx. Thank you both so much for joining me.
Thank you.
Welcome. Thank you for having me.
Of course, of course. Now, when talking about the Bronx, there's so much that goes into it, especially when we're discussing health. Can you just talk a little bit more about the background and possibly a little bit about the historical context for why the Bronx remains the unhealthiest borough in New York?
I'm gonna let you go first.
So I'll speak more about the current history with regards to the pandemic. And I think the pandemic highlighted for the rest of the world what challenges were happening. Within the Bronx, some of the highest numbers we realized was the Bronx was one of the boroughs of essential workers. And that demonstrated and shared lack of food scarcity. There was also housing and rent increases. We were also talking about
Well, I actually want to talk a little bit more because throughout my journey, just as a reporter and just learning about it, I understand that the Bronx, is one of the unhealthiest boroughs. What are some health conditions that disproportionately affect Bronx residents? And that could be from, anything. Could you just tell us, what you've noticed in your work affects Bronx residents the most?
Right. So part of the challenges that the Bronx faces, I guess what I want to really focus on is also the assets, not just the deficits. But some of the challenges, health challenges, are mental health is disproportionate. We also have asthma. And working with the families that we have, I would say some of the things that we've actually dealt directly with is cancer. So we have, in a very short time, we've lost 2 women to breast cancer. And this is in the area of Hunts Point and Longwood in the Bronx.
Thank you so much for sharing that. Now, Sandra, can you tell us a little bit more about BCHN and the work that you do to address the problem of, health disparities in the Bronx?
Well, BCHN is an entity that's been around for 25 years. BCHN has brought $200 million into the Bronx over the last 25 years. Our focus and our mission is to treat the patients that we receive and that come into our facilities as a whole person. We start with whatever the patient presents, but we look at them as an entity, a whole thing. At that point, you want to know what's your health conditions, what's your mental health conditions, what's your physical, what's your socioeconomic. All of these play a part in what makes a person ill. Now, if you ask about the history of why the Bronx is in this predicament, it is basically because of the systems that had put people in the Bronx in this position and don't allow for them to upgrade themselves. When you have systems that are strictly designed for the 1% on the top and the bottom, as that pyramid is shaped, this is what you get. You get health disparities. You get people with diabetes. You get people, because we live in food deserts and they don't get a chance to buy the proper foods because there are no grocery stores or greengrocers in those areas. And the zoning and the prohibit that because the system wasn't designed for the poor. It's only designed for that 1% on the top of the pyramid. So now this is the causation of where we are today. But our agency is in the position now of helping to resolve some of those issues.
Now, I definitely want to take a moment to highlight one of the ideas that you had, and this was using zoning tools. Can you just explain what are zoning tools and how can they encourage new developments in the Bronx that can help address this issue?
Okay, when you have some areas that are being rezoned for these large mega buildings that are going up, when the community should be involved in asking, okay, you're going to put this building up. You say it's affordable care, it's going to be a mixed unit development. Now, what does this do for the community? How does this help the community? The community has to say, well, hey, if you're going to put this building here, we need a clinic in it. We need a school in it. We need childcare in it. We need groceries, a green grocer, grocery stores that actually fit the culture of the community that you place it in. One thing you don't ask about is culturally, what are the foods that the people eat? Oh, you say, oh, they're unhealthy. No, they're not. You have to teach them how to prepare them in a more healthy fashion. So in my clinic, that's what we're going to do. We have health aides education. We have community workers that go out and do educational on a monthly basis. They give seminars, webinars.
We're definitely going to take a moment to talk a little bit more about the resources that you provide. But before we get into that, Dr. Lopez, can you just tell us a little bit more about your effort to boost resources for mental health, especially for those who are parents and guardians?
So we have the Family Enrichment Center, and it is started off as an initiative. We were the first to open in the Bronx, and we were the first to open citywide in New York City. So we have 27 centers that are going to be officially, or 29 centers that are officially open as of July 1. And so part of our efforts is to really organize and support the parents, the individuals of Hunts Point and Longwood, and now throughout New York City. And so those efforts are really to look at social isolation and support families in their efforts. New York City is pretty isolated. For as dense as we are, we're pretty isolated. And so what the Family Enrichment Center offers is a place where you don't have to fill out an application, you don't have to tell us what it is that you want to do at the center until you're ready. So when you come in, it is really for us to work with you and co-create something that is completely different. So one of the things that we created that was extremely different was the business continuum. So we were charged with creating something new. And the community members said, you know what, we don't want another GED program. We want to create our own businesses. So we've been starting a small business initiative called the Business Continuum. And they get micro grants for $200 when they finish those efforts. Mm-hmm. And so this is an opportunity for economic growth in our neighborhoods. So that's a focus on the adults, right? Because it's intergenerational income growth that we are looking at. And mental health. So all of it is combined. We can't work on one without the other.
Now, I want to expand on something that you mentioned, and you mentioned the term multi-generational. You know, what are the benefits that this could have on a generation of children, especially, you know, in the past, mental health wasn't prioritized as it is now, or what we're attempting to do now. So, you know, what effect could this have on children?
So I will share with you that we have a small effort that we after each session that we continue to do, after each session, the family, the adults complete, they get a certificate. And we have a celebration. And in getting those certificates, the parents feel really good about it. We have crying going on, their children seeing them complete and accomplish, getting their micro grant, starting their business. this is a big effort for us because we can see the children extremely proud of their parents and their parents proud of themselves. So that work is really important.
Now, as you both strive for health in the Bronx, but in different ways, I feel that there are some overlapping when it comes to just physical health and mental health. What are some ways these can affect both areas? So what are some ways your physical health could affect your mental health and vice versa?
They go together. You have a person that's depressed. You want to know why. And what is it causing? It'll cause a lot, depression will cause a lot of things. You stop eating. So now your nutrition is health. Everything is, we tend to look at the body and the person as this does this and this doesn't. It doesn't happen. The person is whole. So you gotta treat him or her as a whole person. You can't departmentalize. You gotta know that this person gets 3 meals a day so that you can treat his mental health. If you give a person a pill and say, take this pill 3 times a day after every meal, did you ask that person, do they eat 3 meals a day? That is crucially important. You take a mother with an infant, she comes in, she's getting her WIC, her paper, but you say, do you know where to go to get all of the healthy foods for you and your baby? We can't isolate anything. Everything has to be directed towards the individual as a person, not as an entity or a means of extracting some sort of monetary gain because this person came into your facility and you can bill for the services that you're going to provide. No, you look at that person and you say, that's a human being. I need to treat that person with kindness and dignity.
Right. And doctor, can you just also chime in on that, just with your experience, how they both affect each other?
I am totally with not compartmentalizing anything. Yeah. And one of the things that we tend to compartmentalize is our families, right? So you have youth work, and there's rarely anything for the adults to do, right? So anything in terms of a social environment, you have to pay for. You can't even sit anywhere unless you're buying something. And so this is a place where you can actually socialize, connect with other people, find a support network. And so that support network, you can also find similar stories. I am having challenges with my teenager. You're not the only one. There are other people in that center. We're caregivers of our family members. So you're actually in that center talking to other people, sharing those experiences and not feeling alone on it. So that is an opportunity for growth. And that is an opportunity for a connection within your community, a deeper connection than just your neighbor.
Well, I want to thank you both so much for joining us and having this very important discussion. So thank you.
You're welcome. Thanks for having me.
Don't go away. We'll be back with more Open after this.